I'm very honored and proud to be sharing with you, our governing board, and for our folks who are tuning into our meeting tonight. Thank you so much for taking the time to tune in and to learn a little bit more about the next phase of reopening. I had the opportunity to send a letter home to our families last week, and I shared that with the board on Friday. And tonight's just an opportunity to elaborate on that plan just a bit and be able to answer any questions for the board that you may have. So let's see if we, oh, yay, it works. I love it. Thank you so much, Mr. Fell. I love it when it works. Okay. Everybody, I want to start by first just extending my gratitude, as we all do. And I think if now is not ever a more important time for gratitude, I don't know when is. But this particularly, I really want to just say thank you, first of all, obviously, to our teachers and our staff and the leaders of our school district. But I really want to say thank you to our parents who have been working with us so closely as we've brought our kids back to school in a hybrid model. From dealing with the schedule and the drop-offs and the pickups and the lines of cars, and everyone is just so patient, and all of those routines have been established and everything is going so beautifully, but also working with us with regard to their children and their health. And I'll talk about that more in just a little bit, but we're so grateful to be in partnership with our parents. Everyone is working so hard to have our kids be able to be back in school. So thank you for parents who are listening. As I cough, sorry, no pun intended there, just a dry throat. And then I also want to say thank you to our students. Our students, as you said, Mrs. Liebes, are so resilient and so creative, and they have come back into school and are so happy and excited to be at school with us right now. So our kids are the reason we're all here, and we're so grateful for how hard they're trying and for the work that they're doing both at school and at home. Okay, I want to start tonight by having you remember, gosh, I have this little dry throat, everybody. I'm sorry, this weather. I want to start by really reiterating to our board and to our parents and community members and our staff who might be listening into this meeting, that we are talking about the next phase of reopening. And we remained committed to a careful and measured reopening model. We, as you know, we were in virtual learning. We came back to a hybrid model and really established our procedures and our routines and drop off and pick up, and really working with children about staying distanced at school. And we're continuing to be very measured and careful in the way that we're going to hopefully continue to reintroduce children back to school for as much as we can, in the safest way possible. While I won't tonight, everyone, go into all of those details, we've shared with you on numerous occasions all of the safety measures that we have in place in our district. I'm going to mention a few things, but I want to let people know this presentation I'll post on our website when we're finished. But these two items at the bottom of this slide are both live links to where you can find our safety handbook and our presentation of our reopening plan, in case any parents haven't had the opportunity to listen to the many previous presentations that I've given and that our team has shared our safety measures with you. I still want our folks in our community and our parents to know exactly where those safety measures are, in addition to all of the schools, the safe school reopening plans that every single school has established. So we won't go into all those details, but I want people to know where they are should they want to move forward with going back to review those. So let me begin by just reminding us, I've shared this with you every time we've talked about reopening, and that is our commitments to and our values, what we really have been focused on as we've looked to bring children and staff back to school. One is that we would be committed to following the health and safety guidelines, which we have, and it's an honor to listen to our two school nurses talk about. Our district really is, as I've learned from them, an outlier in our county in our commitment to the health and safety guidelines that we're following and the financial investment that we've made to ensure that we have the safest workplace possible. We've been committed to supporting the social emotional health of our students, as you know, with the additional counselors we added at the start of this year, a full-time counselor in every school, knowing that we would really need to work hard to support the social and emotional health of our kids. We've also worked very hard to create effective learning systems under the direction of Mrs. Julie Norby. Whether it's 100% at home, a hybrid, or now hopefully more and more full face-to-face with our kids, we're really committed to having the educational experience be as effective as it possibly can be. And thanks to the skill and expertise of our teachers, we feel really proud of what our students are receiving at home. And then the last thing I would mention here is our commitment to providing regular communication and engaging our families and community members in soliciting feedback and how we're doing and how we can make modifications. So these are really just what have been our commitments from the beginning, and they remain what we are committed to continue to do all of these things. And at the foundation of all of it is that our #1 priority remains the safety and well-being of our students and our staff. And we know that all of us, much like opening businesses and facilities across our county, that there is some level of risk present when we do anything or go anywhere, and how careful and thoughtful we are about following safety guidelines. I'm so proud of the adults in our system, our parents, our kids. Everyone is working very hard to do everything possible so that we can keep our schools open and we can continue to have more children come back to school. So I want to spend a couple of minutes on a topic that I really haven't spoken with you as our governing board about, but I think it's essential that we bring this up now. And I've included a live link here. I'm going to be referring to some data points that have been established and have been analyzed by the San Diego County District Attorney, Summer Steffen. One of the things that she has a decade's worth of a career focused on mitigating and supporting acts of violence against children. And one of the things that her office has done since the shutdown has been monitoring and tracking the consequences that children are experiencing with an increase in violent, abusive, and predatory threats against children since schools have been closed. And this is a hard thing to talk about, but I think it's important that I won't spend a lot of time here, but I think it's very important for all of us to know, understand, and be aware that children are experiencing very serious consequences in this county and in this country the longer they are out of school. So I've linked a document that she has prepared for the governor's office a little over a month ago. And so people can go to see that there. But I just want to talk about, while we are incredibly concerned about the academic progress of our students and the long-term implications of what it means for children to be out of school this long, we also know that their physical and emotional well-being is also suffering as a result of being away from school for the time that they have been. It's better, obviously, in the fact that we've been virtual with them and checking in with them every day. Hybrid's even better because we're seeing them a couple of days a week. But our ultimate goal is that we get children back to school in the safest way that we can. So there's just a few little data points that I want to bring to light for you and for those who are listening into this meeting. The first one here is about internet crimes against children. What the district attorney has reported is that in the first month of school closures, tips coming in for internet crimes against children were tripled in the first month and quadrupled in the second. Children are spending significant amounts of time online, and we know that the threat of internet crimes against children has gone up exponentially as a result, and they're seeing very clear data that is happening. The second item that I would point to in the data that she has tabulated for us is that the victims advocate part of the district attorney's office in San Diego County has now served 1,000 more domestic violence victims compared to the same time frame pre-COVID. That is a startling number. We know, and through whether it's national data or local, that domestic violence is up, and the district attorney's office is reporting a significant increase in the work that victims advocates are doing in our community. The last thing that I would mention here from this report, and there's many other items, but these were just a handful that I thought were significant for us as we look to this urgency that we have about bringing children back to school. The San Diego Rady Children's Hospital, likely we're all familiar with Rady's Hospital in some way or shape or form if you have children. Unfortunately, some of us have visited Rady's more often than others. Rady's Children's Hospital has a pediatric consult team that they are specialists, pediatric specialists that work in the area of child abuse. And they serve as consultants to hospitals all throughout San Diego when a child comes to an emergency room under suspected child abuse. Physicians in emergency rooms all over our county can work with this consult team because that is their area of expertise. Our district attorney has reported that the number of times that this consult team is working with other physicians in the county has increased 82% since the time our schools have been closed. And it makes sense. Part of the challenge is that, as mandated reporters in school, when our children aren't here and we aren't seeing potentially cases of children who are victims of child abuse, the number of cases that are actually being reported has gone down a lot. And that is not cause for celebration because we know people aren't seeing children now in schools where those cases in the past could have been reported. So I want to end this little piece of sharing this data with you, and that link is there for anyone who'd like to see her summary. But I think what she says here is wise and prudent, which is that we can't prevent all harm, but we can reduce it. And we can't eliminate all risks of the pandemic or all risks of abuse to our kids, but we can reduce the harm by bringing about a balance that considers all of the harms and manages them under a totality of circumstances and not by one narrow focus. I think as we've all been immersed in the media around COVID, and there are clear and really important dangers for people, right, in this disease, there are also clear and significant dangers for children the longer we are at home. They are at home. And so our job is to manage this. How do we balance the risks for bringing children back to school, knowing that them being at home, for many of them, not all of them, but for many of them, is much more dangerous for them to be at home. So our job as a school district is to continue to do and to make our learning and working environment as safe as it possibly can be, which is really what we've done and what we're going to continue to do in a slow, measured way to begin to bring children back to school. So I want to just kind of remind you remember, we right now are in phase 1. We are currently in our hybrid model, Monday, Wednesday, Tuesday, Thursday, and we started that model on October 5th after starting the year in an all virtual format. This next phase is the next small step. Our TKK and first grade students coming back to school 4 days a week. So rather just Monday, Wednesday, or Tuesday, Thursday, we want them Monday through Thursday, 4 days a week, beginning November 30th. And I'll talk more about that specifically in just a minute. And then the third phase, as I've gotten lots of questions and emails from teachers who are eager to have their kids back and parents who want their kids back too, we are going to continue a measured but thoughtful process. And in the next phase, we'll be looking at what additional grades and or groups of students, including children with significant learning loss, children who might be having some sort of learning challenges at school. We're going to be working as a team to consider what next groups and or grades can come back and with a goal of looking to do some additional adding of children again in January. And that's all being said that as long as we're monitoring the health data, the COVID data in our community and in our county, as I've said from the beginning, that helps us make decisions about what we're doing. And if things get significantly worse, then obviously the plan changes. But that's what we're looking towards. So right now, we're looking for our TK kinder and first grade kids to come back 4 days a week. And this is one of, in addition to all the things that I've been talking about, this is one of the most important ones, as Mrs. Lieber mentioned earlier, that the foundation for long-term success in school begins with a strong foundation in literacy. And we know this, and it's established in these grades. Children learning to read is the most important thing that can happen in their early grades, and their numeracy and in their math skills as well. But this foundation in literacy will contribute to their success or will contribute to their lack of success going forward. And we want to make sure that our littlest ones are coming back to school to get that literacy instruction face-to-face that they need. In addition to knowing that our littlest ones are the ones who are really struggling with their independence and being able to work in this online format at home. So that is the reason we're starting there. So I want to be clear, November 30th, our TKK and first grade students coming back Monday through Thursday in person at school. Our Fridays remain virtual. Okay, that we are right now currently on, everyone is virtual on Fridays. That is going to continue to give us opportunities to provide more small group intervention. Those things are happening now. We're working with our principals and our teachers to start bringing in small groups of kids on Fridays to be able to provide intervention for children who are struggling. But the children will also be on the same schedule they are now. So everything stays the same. There might be some tweaks at individual schools for drop-offs and pickups, just because of managing a few more cars that are coming into the schools, but our principals will work directly with these groups of families to talk about what that if any adjustments need to be made. One thing I also can anticipate that I would mention here is adjustments that may need to be made to class assignments. I'm going to talk a little bit more about we're adding additional teachers to these grades in every school to lower class size even more. And that may result in some children needing to make a change in teacher. And that is something we don't ever like to do. And we try to do this in the most minimal way possible. But if we're going to lower class size, which we're going to do, then it could involve some changes to a new teacher. And we think that challenge in the long run is worth it. We'll hire nothing but the best teachers, and they'll jump in and get to work in the grade level teams that are already existing. But the opportunity to be at school 4 days a week is what we're hoping is, while it could be a bit of a discomfort to make a change for some, we think it's better in the long run. And we're going to make those transitions as smooth and as easy as possible. For everybody who's on the line and listening, and those in the future, 2nd and 8th grade is exactly the same. Right now, 2nd and 8th grade is going to continue to do exactly what they're doing, but in the future, we'll be looking to potentially 2nd and 3rd grade. Their class sizes are lower in the district, as maybe the next couple of grades that we would consider after the holidays. But that plan will be thoughtful and measured just like this one is. But I just want everyone to know that 2nd and 8th grade kids are going to stay where they are.
2nd through 8th grade.
Pardon me. Yes, thank you. 2nd through 8th grade, not 2nd and 8th grade. Thank you for that. The question that was asked about if you have a child in TKK or 1, but you have another child that's in the other grades, we want to work with parents who are in a circumstance where that poses a hardship, having the littlest one come back. Remember, we have worked very hard with the Boys and Girls Club to establish day camps in all of our schools. Those are running beautifully. And that is an opportunity that we can work with parents who may need to make some adjustments to their work and or childcare schedule. So we would encourage any parent who's concerned about having that happen that they reach out to their child's principal, and we'll work on supporting them as best we can. So I want to just emphasize this now. We are, as we look to bring back these our littlest students, we are having our continued commitment to safety. We are adding to lower class size even further than we already had at the start of the year. We're adding additional TKK and first grade range teachers to every school to bring our class size average down to 18. In some cases, we have classes as low as 14, 15. The average class size in our district will be 17 to 18 students in a class coming back in the TKK and 1. That is really our effort again now to add another almost $500,000 of expense in order to maximize distance between students in the classroom. And we feel really confident about that and feel very grateful that we're in a financial position that we can do that right now. We know that we also have face coverings required for all students. That's something we've been committed to, and our students are doing beautifully for the most part. Every now and then we have to work with some kids, but our kids are doing such a great job and are such troopers with this. And then the last thing I would mention here is that we really are committed to stable groupings. And remember, those are cohorts of kids that stay together. You know, in some of our neighboring districts where we're hearing lots of concern about what's happening, often that's happening because kids are mixing all day long from class to class. It's very difficult to get stable groupings in a high school, as an example. But in our elementary schools, we have very stable groups of kids who stay together. They have play zones at their recess time. They have dedicated play equipment that they use just in their group, and then it's cleaned before someone else uses it. We have limited sharing that's going on, and obviously tons of extra supervision that helps remind little ones about distancing, and they're going to continue to get better and better at this as we go forward. So I want to just highlight for you, everybody, I want to put this in context, the additional resources and the financial investment that our school district has made to support student safety. Right now, we are a little over $3 million in investment in what we've done to create a safe workplace and a learning environment for children. You know that number one at the top of that list was that we started out reducing class size. You'll remember we added teachers to keep our class sizes low, particularly in the upper grades and in our middle school. If you jump down to number 15, those are now even more teachers we are adding to TK, K, and 1 in order to bring our class size down even farther as we look to bring all of our TKK and first grade children back to school. All of the things that are on this list are going to look very familiar to you. We've been talking about these for months and months, but I really wanted to quantify this for you. This is so far what we've done. And we have been in the financial position with the support we've received from things like the CARES Act and our really thoughtful budgeting process to really maximize the dollars that we've received in our school district. We've invested in what's necessary in order to create a very safe workplace, as our district nurses had shared with you earlier. We do, as our nurse Kitty shared, we are one of the very, very few school districts in the state of California that has a full-time LVN in every school. That is not common. And we have 2, soon to be 3, credentialed registered nurses who manage everything related to our COVID education and our process for managing when we identify children who may be sick, or the reporting that's involved. And so we're very, very proud of the work that they're doing to support us as having the expertise in this area as registered nurses. That expertise is incredibly important now. It always was important to have a great school nurse. Some of us can remember that was like the person like why you came to school, because you'd stop by and see the nurse when you were little. Most school nurses, they're the ones that the kids, sometimes they're like, oh, I'm not feeling so good, because they love their nurse and they want to go down and see. We're so lucky that all of our LVNs and nurses are incredible. They're incredible, and they're really helping us do this really thoughtfully and well. So we appreciate them so much. So I want to connect that work from our nurses to our parents. And one of the things that's so important in this process is the partnership we have with our parents. Our parents have been wonderful. They have been so careful about doing those health screenings at home. That's what we need for them to do. Now, we do initial visual screenings of children at school, but our parents have done such a great job. And when their child seems not to be feeling well, they call the school and say, my child's not feeling well, and they're keeping their kids at home. Or if a child comes to school and all of a sudden isn't feeling well or is coughing, or we immediately have a process for when we see symptoms in children, and we call moms or dads or grandmas or grandpas or friends and folks that are allowed to pick up a child from school. And they always, while sometimes it's so frustrating because we think, oh, it's just a cough, or they have allergies. One of the things that's so important is that we're all doing everything we can with an abundance of caution. So our parents come to school and they pick up their kids, and then we do an isolation practice until we make sure that they're well before they come back. And that's hard, but we're all working together to make this thing go. And I just feel so grateful to our parents who are really working with us so that we can keep our schools open for everyone. It really takes all of us working together. These are the symptoms. I just thought I would just remind everybody, these are the symptoms that we need our parents to be checking their kids for, and we're really counting on them to do that, and that when kids are not feeling well, that children stay home. And we have wonderful plans that are, if kids need to stay home, they're working with their teachers and they have opportunity to continue their schoolwork at home. So those practices will continue. And then we have a very clear process and protocol that we follow. And we've gone over this with you before, but it's just a reminder for folks that we have, with the guidance of our nurses, with the support of our LVNs, we have a very systematic way that we immediately respond when children or staff members aren't feeling well. And we work with, our nurses and our LVNs work directly with families to help manage this process. Because it may not be COVID, but it could be a cold or something. And we're all being extra cautious now, as you know. I would mention that we know that you've seen in the papers and districts and schools all over the country that when you have positive cases of COVID-19, it could result in a temporary closure of a particular classroom, and where a classroom may have to transition to online learning and then transition back. And we know how to do that well. We started that way. But we are very confident that and feel very hopeful that this is going to be a rare occasion for us if this happens. There's no guarantees, but we're going to work very, very hard to avoid classroom and school closures. We have not had to do that since we've been open yet, and we're really, really proud of that. So I just would mention one of the reasons, this is from a previous presentation, but for those folks who might be listening to this one who haven't seen, these are just some of the things, and they've been covered in detail in some of the other things that are posted on our website. But disinfection and sanitation, physical distancing, maximizing the space between students is what's necessary, air filtration, food services. These are just some of the things that we've done to really contribute to the health and safety of the people and the children who are in our schools. I wanted to bring some numbers to this one as well, which we haven't shared with you before. We, as you know, have added additional custodial support to all of our schools. And one of the best things that's happened is When you go to a school now, the kids get to actually see, we have our bus drivers who will, in between their bus routes as they're driving for our special ed kids, they're going to schools to help with disinfecting in between, they're in the middle of their day. Substitutes, we have significantly increased custodial support for disinfection. And so I want you to notice that there at the bottom. And over 600 hours across the district of additional custodial support is now in place in our schools. It's one of the things that I go to when I'm at a school. What I see is literally everywhere you look, there's someone walking around like wiping a door handle or cleaning a desk. And it's something that is needs to happen. And we feel great about it. And we're so proud of our employees who, every one of them said, how can I help? I'll go to a school. What else can I do to help so we can get our kids back in school? This is a lot of manpower, and it's part of the financial investment we've made. These are folks who are making extra pay, doing extra hours that's outside of their typical workday. So it's wonderful for our employees, and it's financial investment for us to support this health and safety of our staff and our students. So all that to be said, everybody, I want to take a little moment here to, as we have folks listening into our meeting tonight, there may be parents in our district who would prefer that their child not come back 4 days a week in these grades, TK, K, and 1 for now. And I want to just remind everyone that we do have choices for parents who may not want to have this happen. Our Fallbrook Virtual Academy and our homeschool program. And those are two different programs that they're in existence now. We have about 440 or 50 kids in our virtual school, right now, our virtual academy. It's running beautifully. That's about 10% of our district's total population. 90% of our parents have their kids in school. And that is very consistent with the data that when we collected survey data from our parents over the summer, way back then, they said about 10% of our families said we would prefer a virtual option. And about 90% of our families said, I want my kids to come back to school. And that's exactly what we're seeing that's happening now. If this is a decision though, if this next phase is something that families don't feel comfortable with, we want to work with them as we have all along, and they simply need to reach out to their child's principal, and their principal can get them in contact with the right person to make that transition. But those options are available for our families. So as I've said to our board and to our community since the beginning, you've seen this slide many times, that our plan's based on data and guidance from public health. And if the conditions change, so will our plan. And we've made changes off, little tweaks and changes over the course of since being open. But if the conditions change, so will our plan. Our parents, we understand and know that there will be questions about our next phase of reopening, and our families can count on hearing from their principal soon in the coming days about maybe potential little changes that need to happen, and to answer any additional questions that our families may have about bringing our littlest ones back to school next. There's also a contact form on our website, and we receive those and respond to those also right away. So there's lots of ways for people to get in touch with us, and we're happy to answer questions and continue to provide support to our families as we all look to try to get more of our kids back to school.